Hi everyone and welcome to Dance Podcast Season 3. I'm your host, Jasmine Cook. This is a dance science podcast presenting discussions with global industry leaders, aiming to make research and information more accessible and enhance dancer wellbeing, health and training at all levels of the sector. New episodes every Monday, 6 a.m. London time. Thank you so much to The Place for sponsoring today's episode. Located in the heart of London, The Place is a creative powerhouse for dance development that is leading the way in dance training, creation and performance. One of Europe's most exciting, innovative dance spaces, where artists from all over the world come to push creative boundaries, to experiment, and to perform outstanding new work. The Place is home to London Contemporary Dance School, a 288-seat theatre, an extensive range of classes, courses, and participatory opportunities for adults and young people, and professional development programs for artists. Check them out at @theplacelondon on Instagram, and they'll also be linked in the show notes. I'm here today with Dr. Brooke Winder, who is an assistant professor and coordinator of the Dance Science undergraduate degree program in the Department of Dance at California State University, Long Beach. She is also a licensed physical therapist, specializing in orthopedic and pelvic floor health. Through her clinical practice, Renew Motion Physical Therapy, Brooke provides virtual wellness care, on-site physical therapy services for pre-professionals and professionals, and educational workshops for dancers. She is especially passionate about educating the dance medicine community about pelvic floor issues such as incontinence, prolapse, and pelvic pain, and contributing to emerging research on this topic. She is presented at the International Association of Dance Medicine and Science annual conference, Performing Arts Medicine Association International Symposium, and the American Physical Therapy Association's annual Combined Sections meeting. Brooke has been published in the Journal of Orthopedic and Sports Physical Therapy, Journal of Electromyography, have I said that right? And Kinesiology, and the Orthopedic Physical Therapy Practice magazine, and also in One, the publication of One Dance UK. Brooke earned her doctorate in physical therapy from the University of Southern California and a Bachelor of Fine Arts in Dance from Chapman University. She is a board-certified specialist in orthopedic physical therapy and a certified Pilates instructor through Body Arts and Science International, and a former professional dancer. She also serves as an expert for Pivot Dancer, an online platform aiming to bring science into the dance studio for both dancers and dance educators. So Brooke has had quite the career, obviously. I'll let her introduce herself. It's so great to have you here today, Brooke.
Yes, thank you so much for having me.
If you just tell us a little bit more about your background. So you mentioned last time we spoke, you've always been sort of an artist athlete. You have your BA in dance undergrad, and you also always had an interest in science. So just sort of tell us about a bit more personally about how you got to where you are now.
Sure. As you mentioned, I grew up dancing. I was also a competitive gymnast when I was really little. So I've always been a mover. And through that journey, like I think many dancers, I experienced my share of injuries, and most of my injuries were overuse injuries, which is so common. And so I had experiences, particularly as I dove into my teen years and then went into college, figuring out, navigating how to get the best care for my injuries and knowing how to talk to physical therapists or doctors about what was going on. And I had a real interest in kind of understanding the injury side. I loved my anatomy class when I was in undergrad as a dancer. Really liked that side of the sciences. So I kind of noticed two things as I was growing up in dance and experiencing injuries. One was how much I was jazzed about learning about it. And number two was having the experience that I think a lot of dancers have had, which was a lot of the physicians I would talk to or healthcare practitioners I would talk to, if they'd never danced before or never seen dance or never had exposure, they didn't really understand what I did. And I don't think they really realized how much of a sport it was or how hard it was. And it felt really difficult to navigate. The advice that would be given at the time was, well, just stop, just take a break. There wasn't anyone that could help me navigate sort of the in-between and how to get back to it. And so that sparked a big interest in me and maybe becoming someone who down the road could actually help bridge that gap and help dancers, who came to me to be able to be understood. So that got me really excited about things involving something like physical therapy or physiotherapy, depending, where you are in the world. And so I did a senior project in one of my classes where I sort of investigated what it would be like or what you need to do to go to physical therapy school or go into the healthcare professions. So it was something that was always in the back of my mind. And I took some of the prerequisites I needed, but I really wanted to perform when I finished my undergraduate degree. So I danced with a regional modern contemporary company called Backhouse Dance. And so I got some time. I spent a few years doing that. And like a lot of new professional dancers, I also worked lots of other jobs to pay the bills. As I was early in my career, and I, during that time, got Pilates certified through Body Arts and Science International. So it was a great way to start working with clients and working one-on-one with people. Some dancers, but a lot of people who'd maybe never moved before in their life, which is a really great learning experience. But even as I was working with my clients, I realized that a lot of the time I felt like I had to just work around their injuries because I needed to respect the injury that was happening, but I didn't have the qualifications to directly help them with that injury or understand it in depth. So that kind of reinforced or kept me going back to the idea of something like physical therapy. And so I decided to dive back into graduate school after a few years of performing. So I've gone through the transition of dancing a lot to having it be, sort of a different place in my schedule. And so I spent 3 years in a Doctor of PT program. And at the program I went to, it was pretty, I guess, lucky for me that at the time there was someone that was doing research on dancers while I was in school there in their biomechanics lab. So one fun thing that I got to do throughout my experience there was be part of the team that worked on some biomechanical studies in dance. And so that kind of, I guess, just got my hand in it a little bit. I got to learn a little, even though I wasn't getting a research degree. And then I started treating patients and kind of coming out there into the world. And I also did a post-professional residency, which here in the States is, once you're licensed as a PT, you can do some specialized studies. So I spent some time still at USC, where I did grad school, getting some extra mentorship, getting to learn directly from orthopedic surgeons and getting to do rounds with physicians, as well as teaching. And I taught actually in the graduate program as an assistant, which made me really, really realize how much I love to teach. So as you can probably imagine, I'm somebody who's interested in a lot of things and gets really enthusiastic about a lot of things. So as I, was treating patients after this, I saw patients anywhere from kind of teen years up to people who are 100 years old. And then I was treating dancers, a lot of pre-professional adolescent dancers at the time. And I just started giving workshops on health and started doing some teaching on the side and giving guest lectures. And after a while, the job that I currently have opened up, and I decided to see what it would be like if I can transition out of the clinical world and directly into working with dancers in a university program. So I have been coordinating the dance science degree at Cal State Long Beach this is my 6th year. So I made kind of a big transition from full-time clinic care to just part-time clinic care and lots of teaching and mentoring, which has been a really cool way to allow me to do research, to allow me to work with college level dancers, to allow me to still practice. And when you're in academia, you get to keep learning and focus on learning, which is kind of the main thing I love to do besides teaching.
Yeah, definitely. Oh my gosh, there's so many things in there that I would like love to ask you about today. I'll try and keep it focused, but yeah, you've just had such a varied career. It's amazing. So you mentioned, just to go right back to the start, you noticed quite early on that there was a bit of a lack of communication between that you felt as a dancer between healthcare practitioners and dancers. Just sort of a struggle to communicate because they couldn't always fully understand the demands of the dancer. So could you tell us a little bit more about this and maybe how it influenced the way you practice now or your career journey?
Yeah. I mean, I don't think that experience feels unique to me. I talk to so many dancers who feel discouraged when they see a healthcare practitioner because they don't feel understood or listened to. And I think that's often universal in a lot of healthcare. That's something we really need to work on, but I think particularly for any performing artist. So I feel like that has probably influenced me in a couple different ways. One of the things I feel really strongly about is that it would be great if we could educate every single healthcare practitioner to deeply understand dance, but that's somewhat unrealistic. So one of the big things that I try to do as I'm educating students or I'm educating my patients is teach them some strategies about how to explain what you do and how to be an advocate for yourself. Because here in the US, we have a pretty complicated healthcare system, for example, and you really need to understand how to do your best to explain yourself and ask questions and seek out information. So I think it has influenced me a lot to empower dancers because I think we deserve to know more about our health. We deserve to know more about our bodies. We don't have to have it all be a mystery and then, try to go to someone who's really just like has this information but doesn't know how to translate it to us. I think that we can be part of bridging that gap. So I feel like that's really influenced that education piece in me and the way that I teach people about themselves and their health. And then I think it's also encouraged me to want to advocate for dancers and teach healthcare practitioners, about dance. So one thing I do in the pelvic health world in conferences and actually just created a continuing education course this last summer that's online is to teach people who are in pelvic health to understand a little bit about dance so that if a dancer comes to them, they can at least ask a few questions that help put some dancers at ease and show that they're open to learning about it, even if they're not an expert in dance.
Yeah, for sure. I love especially what you said at the start about teaching dancers how they can advocate for themselves, because I think that's something that, I don't know, maybe sometimes we overlook. So I often think like, oh, everyone should understand about dance, but that obviously isn't realistic. And so I think giving dancers the power to be able to, yeah, ask for themselves and get the information that they need is really great. To look a little bit about your journey as a physical therapist. So you mentioned you were exposed to biomechanics research. Was this something that interested you straight away? And did it make you want to pursue it further? Or yeah, tell us a bit about that.
Yeah. Oh, that's a great question. So it definitely interested me straight away, but you know, at the time I was in an entry level, clinical doctorate program. And so the focus is really on learning how to be a PT. So it did feel a little bit overwhelming because I was working, our program also had a PhD program in biokinesiology. So when I would work with PhD students and discuss the information, I think that it was overwhelming in the context of my entire program, but it was also really interesting. It's very, very mathematical and very much about learning, how to really understand processing data. And that's kind of the place where I was sitting at the time. I would watch a lot of the data collection, but I didn't get to know all the ins and outs about how the computer system worked. But I found it really interesting. I think probably anyone who ends up in physical therapy who's also a dancer is like, we're big movement nerds. So biomechanics is really exciting to me. So even though I am not a biomechanics researcher, I haven't I haven't gone deep into that area, I do still have the opportunity to work in teams with people I know, even from grad school, who are really specifically and really heavy into biomechanics in their research. And so, some of my publications have looked with these teams of people. I've been part of some biomechanics research in the last several years, looking at Achilles tendon issues, FHL tendon issues in dancers. So part of why I haven't been able to really keep up as specifically is in my dance department, we don't have a biomechanics lab. We don't have someone specifically looking at that. But what's nice about my university is there's a department of physical therapy at my university. There's also a department of kinesiology. And they both have biomechanics labs. So I've been able to kind of dive into some things or be part of those teams. So I do still find it interesting, but kind of with the way I've been diving into my new research lately, I haven't spent as much time in those areas.
Yeah, definitely. So you're a clinician now mostly, but you love educating sort of on the side of health and science, as well as treating your patients. So they're kind of your two main passions at the moment, I guess. Am I right in saying that?
Yes.
Yeah. So could you tell us more about this and what you do at the moment? And then we'll get into the actual topic of the podcast. But there's just so much I'd love to talk to you about.
Yeah. So, I'm full-time tenure track faculty at my university, and we are really a teaching first university, which means I teach quite a bit. So on the teaching side, more in a formal way, I teach our functional anatomy class for dancers. I teach a course that it's called quantitative analysis for dance injuries, and it's for our dance majors to understand how to read journal articles and how to understand statistics and understand how their health might impact their injury risk, and to assess injury risk and then to understand recovery. It's kind of my course where I'm able to sneak in lots and lots of information for dancers about their health. And I also rotate into our Pilates class, so I get to teach movement and conditioning. And I teach our grad students in our MFA program as well, a dance science course related to teaching. So that's like more of my official teaching roles, where I'm creating curriculum. And what I love about that side is I think just a big part of understanding injuries, looking at our overall health is, and maybe I mentioned this before, but just helping dancers know more. I think that it's something that if you're going to use your body as an instrument, you should know and be able to understand your body, and to be able to understand all of the things that impact your body, like your mental health and your digestive health, and kind of the basics of how to recover well and how your sleep impacts your health. And I feel like those big, sort of how I relate that to my one-on-one work, whether I do wellness or physical therapy care with patients, is a lot of what we work with is understanding kind of the whole picture. Like, what's going on in your life right now? How is your stress impacting your healing? What kind of a support system do you have? Are you eating enough food to actually support recovery? And it's not that I necessarily am qualified to specifically do all those things for my patients, but I help figure out, do you also need a nutritionist, a registered dietitian to help you get where you want to be in your recovery from your injury? Because that one could be one of the major things that's actually getting in the way, and why someone's getting injured so much. And no matter how much I correct their mechanics as a PT, someone else might need to be working with them to help them out to, do the best job for them. How mental health is impacting my patients is huge. And I think we've seen that really come to the forefront, in particular these last couple of years of huge amounts of stress. And so does my patient need to talk with a sports psychologist who understands dancers? Does my patient, need a therapist to help them navigate these issues that are causing, their body really to respond in a fight or flight state all the time. Um, so I feel like it actually, the things that I study and put together for my students when I'm teaching help remind me of all the big pieces that my patients, could be impacted by when I'm working on, them recovering from an ankle sprain, or if I'm working on pelvic floor health with them. So I hope that makes sense, how
Yeah,
that relates.
no, for sure it does. I was just thinking, I'm not sure if it's the same thing, but I think it was a post on Instagram or something the other day, and it said that the majority of us are not Olympic athletes, and we're not looking for the extra 1% that's going to be the thing that tips us over or makes us better at our sport, but we're looking at the other 99%, which is sort of like your sleep, your nutrition, all the basic things. Is that kind of what you mean?
Yeah, I think that that sometimes, especially because the amount of health information that is available to us now is so vast, and it's hard for people to know. I talk a lot about this with my dance students when we talk about wellness, like they're not sure how to find quote unquote the right information or the most helpful information. And I think that we're also in the age of, you see every fancy exercise in the world on the internet. You see so many complex ways, and therapy tools and taping strategies. Like, it's just so much. And I think because we are often bogged down by too much information, and we didn't always have too much information. Maybe we were actually at a point where we didn't have enough, I think that we sometimes forget about the basic things that are, I guess, often kind of unsexy because they're very basic, but we don't realize maybe we're actually so sleep deprived that our body can't recover. And that's why we're actually, we know sleep deprivation increases our perception of pain, and it lowers our pain threshold, and it makes us cranky. And it makes our brain foggy. So we can't learn in class, or we can't control our balance as well. And so I think sometimes when we can have those little moments of thinking about, like, just like you said, sleeping, eating, drinking water, and, caring for our stresses by either building community or accessing therapy if you can, or, having a friend to support you. Some simple things like that are actually things that, in particular, my college level students, I think it can benefit them to go back to some of those basics. Because when you're in university training or pre-professional training, you're often not sleeping enough, you're often very stressed. And so it can target some of those things that are basic, but are really, really common problems that will actually increase risk for injury.
Yeah, it makes a lot of sense. So looking at those college level dancers, you mentioned them when we spoke sort of briefly last time, that you really enjoy working with them as a group. So your main areas, which we're going to focus on today, are orthopedics for dancers and also pelvic floor health. So you work mostly with college dancers, is that right, at the moment?
So yeah, I work with college dancers, the dancers at my university, because I'm more in a teaching role at the school. I work a lot on the side of wellness, and a lot of the things we work on are much more orthopedic related, although and that's simply because in a wellness appointment, I'm usually teaching and mentoring undergraduate students, and so sometimes pelvic floor is, and we'll get into this, can be a little bit too intimate or uncomfortable for someone to talk about in that setting. So in my private practice, that's where I, work with a multitude of dancers, and then, people who love to move. So kind of the artist athlete area is where I live. And I'll treat pelvic health or orthopedics, or both. They kind of go hand in hand. So I see a lot of spine issues, hip issues, and then the shoulder as well. But I really like working with adult dancers, I guess I would say. So anyone from college level and beyond. So people navigating their professional career, or people who have, been dancing at a high level, and maybe that role has shifted. They're a dance educator, and so they're really pushing their body, but in a very different way. We all know the demands of being a teacher, or people who are navigating, the prenatal or the postpartum experience in their life. So I guess I would say the artistic athlete kind of across the lifespan.
Yeah, definitely. You've put that really nicely, I think, because so many of those different areas, even if not dancing full time, have so many different demands on them. So the
Yeah.
focus of today's podcast is going to be pelvic floor health in dancers. So could you just give us a bit of background? This isn't something I've ever touched on before in a podcast at all, really, I don't think. So a little bit of background as to what research exists already in this area, or maybe a more relevant question would be, what research was there before you began to research in it?
Sure. So we can talk a little bit more about, what pelvic floor is and what pelvic floor issues are. But a lot of the research that is out there now is, there's quite a bit of research on the general population. So people who might not be specifically participating in certain sports or in dance as a sport, looking at issues like urinary leakage, so leaking urine when you don't want to be leaking urine. There's a good amount of research that it is a relatively common experience, particularly for, we've seen higher rates in female identifying people in general, but that doesn't mean that people who identify otherwise don't experience leakage. So they certainly can. And so some of that research has centered around issues that come up after you have a baby, for example, and that's probably, I think, the most familiar place where people may have heard of the pelvic floor when it comes to pregnancy or postpartum experiences. There's also research on pelvic pain and chronic pelvic pain issues. So that's really been out there, but the research that interests me most as it relates to dancers is there is a good amount of research, particularly in the past 10 years, maybe 15 years in particular, looking at female identifying athletes and how they experience leakage or incontinence, and particularly athletes that are in a multitude of sports or impact sports. And that could be anything from being a trampolinist to a gymnast to a volleyball player, a basketball player, or cheerleading. And some of those studies have included dancers, but just two or three, and out of several. But dancers have fallen into the mix, although in those bigger studies, they're not always defining, like what kind of dancer, what dance forms are they practicing? It's just sort of dance in general. But what's interesting is that in female athletes in general, there's a significant amount of leakage that's happening, leaking urine, and this could be happening during sport, or this could be happening kind of randomly throughout the day. So depending on the study, it's anywhere from usually about 25 to 35% of high-level female athletes experience leakage, which is a third. So it's a big amount, and it's also something that, in anonymous surveys, a lot of them will say that they feel uncomfortable saying anything about it, or they might not talk about it or always report it because it can feel embarrassing or really sensitive.
Yeah, definitely. That's something that we'll look at a little bit more in a bit. So just like you mentioned there, if we just go back a few steps, just to start with, what actually is pelvic floor health? What's the role and the function of the pelvic floor?
Sure. So the pelvic floor, I think we can probably talk mostly about muscles today, but the pelvic floor region is basically the region that sits at the base of your pelvis, kind of within the bowl of the pelvis. And so there are muscles, your pelvic floor muscles, that span, so they basically span from your pubic bone back towards your tailbone. So if you're sitting, you're basically sitting right on your pelvic floor muscles. And then the muscles also span kind of like a hammock side to side from inner hip to inner hip. So, if you're sitting and you feel your little sits bones as a dancer, the muscles span from sits bone to sits bone, essentially. So you can imagine it like a hammock or a basket that's kind of filling in that base of the pelvic bones. And there's lots of other structures there that are considered part of the pelvic floor. So there's lots of fascia and connective tissue to suspend your organs in place. And the pelvic floor muscles help with those organs to support that area. And then packed within that region is, your bladder and your rectum and the organs, the ligaments that support them. And then if you have a uterus, the uterus is packed right in there. And if you have a prostate, the prostate's packed right in there. And I think you asked about function. Yes. So the pelvic floor muscles, and we'll talk about them as the pelvic floor. There's actually 3 different layers and they all have specific names. But in general, they have several functions. So possibly one of the more familiar functions, if we talk about things like leakage, is these muscles serve as sphincters, which means that they close the openings. So when you need to be able to hold your urine in and your bowel movements in, these muscles help those sphincters stay closed. And they also help relax when you need to pee or when you need to have a bowel movement. So it's important that they don't just, contract and close those openings. They also need to relax and allow those things to open when we want them to. Possibly less familiar functions would be these muscles span across the pelvis. So they actually help with pelvic stability, which is hugely important for dancers. They help support the organs along with the, the ligaments and the fascia that are there. So they're helping keep the placement of your organs and help them feel supported. These muscles have sexual function. So things like arousal and orgasm are actually helped and controlled by the nerves and the muscles there. And then these muscles are really interactive with managing pressure, like the pressure that's in your trunk, that's kind of held underneath your diaphragm and behind your abs and in front of your spine. That whole area of organs and tissues is basically a pressure system. So the pelvic floor sits at the bottom and helps manage that. Like when you cough and sneeze and you need to develop more pressure, or when you sing really loud, or if you have to breathe heavier. And then these muscles actually also work a lot with your diaphragm. They work in parallel. So they help with breathing essentially, and are part of the breathing control that you have. So hugely important for dancers.
Yeah, I was going to say, we'll come on to it more in a bit about how relevant it is for dancers, but just thinking about it there myself, I can already see there's obviously a lot of relevance for dancers. But just quickly first, so when it's not functioning properly, what can happen and what are the major flags sort of that there might be an issue there?
Sure. And one thing that might be helpful is when you think of the muscles not functioning properly, that could mean lots of things. I think a lot of people, so when I start to name these symptoms, a lot of people think, okay, that's probably because my pelvic floor muscles are weak and I should strengthen them. But sometimes it's actually because they could be weak. That's really common, maybe postpartum or after you deliver a baby or if you've had an injury there. But they can also be overly tense or overactive, or fatigued or overloaded, which we think is likely the case in a lot of athletic populations, including dancers, and can talk about why that probably is. So if these muscles aren't functioning properly or they're being overloaded, urinary symptoms are common, but that could look like what we mentioned before. That could be leakage, and that could happen at different times. Like I just leak a little bit of urine when I land from a jump. And it doesn't happen all the time, but it happens sometimes. I never tell anyone about it. That could be you finish going to the bathroom, you finish peeing, and then maybe stand up and a little bit more dribbles out. It doesn't feel like you fully emptied. It could also be experienced as urgency, which is the feeling like I really have to pee and it feels almost painful and I'm not sure I'm going to make it to the toilet. And maybe a little bit dribbles out. or the feeling that you have to pee a lot, like, so that's typically called urinary frequency. And this is a symptom that a lot of dancers can experience. It's not that uncommon, but urinary frequency is having to pee more often than every 2 to 4 hours. So if you have to pee every 30 minutes or every hour, and that's a pretty regular thing for you, it's not just because you've guzzled a ton of coffee or tea, that can be one of the signs that your pelvic floor might need a little bit of TLC. Let's see, or feeling like you might have a bladder infection, but you keep getting tested and it's actually negative and you don't have one. You can't figure out why you feel like you're just kind of bladder's irritated or annoyed. You can also have bowel related symptoms. So this can be trouble holding in gas. This can be also constipation or pain with bowel movements. And these things are not unusual in really athletic people, including dancers. Or rectal pain, rectal spasms that sometimes seem to go along with tailbone pain. And or feeling like you have back pain or tailbone pain, and then when you have a bowel movement, it actually feels better. That could be related. You can also have symptoms of pain, and that could be, anywhere along the floor of the pelvis. That could be pain in any genital area. That could be rectal pain, pain along the perineum, which is basically the part that you sit on. So sitting pain can be related to the pelvic floor. Tailbone pain, I'm going to mention it again just because we've have a good number of dancers who've fallen on their tailbone at some point, or fallen out of a lift, or had kind of a, an odd incident in a rehearsal and an injury to the pelvis, and then that tailbone pain doesn't quite get better. Your pelvic floor muscles are actually attached to your tailbone. So it can be very related. And then sometimes pelvic floor symptoms are kind of sneaky in that you can feel them. If the problem is in the pelvic floor muscles, you can actually feel back pain or hip pain or groin pain that feels like another orthopedic issue. So that can be a little bit confusing. And then symptoms of pressure are also common. So that can feel like a falling out feeling, or just like a lot of people just say it's like pressure or heaviness in the pelvis.
Yeah, that's a really great overview. Thank you, Brooke. So how might, looking a bit more at this for dancers then, how might these issues impact dancers specifically, and why as well?
So I would say, one thing about these symptoms is they're very inconvenient. And I know that seems so maybe sort of silly or simplifying things, but for example, if you're having to pee all the time, that's going to influence how you maybe stress about the way you plan your rehearsals or your travel. So if you're on tour and you worry about, like, can I get up while I'm on the plane? Am I going to? So a lot of anxiety can be wrapped around. It's not unusual that if dancers are experiencing these symptoms, and it's similar in other sports, that it's not necessarily probably going to prevent you from dancing, but that feeling of discomfort can just impact your daily life and your daily amount of stress. There can be a lot of stress and anxiety wrapped around those symptoms because you're not sure if it's something you should worry about, and you're not sure what you should do about it. And a lot of people don't say anything. They just think that this discomfort might be normal. I guess this is just what people experience. So I think that general, anxiousness and daily discomfort can be really impactful for dancers who already have often very stressful, demanding lives and demanding schedules. And then I think on the general movement function side of things, a lot of times if the pelvic floor has some imbalances or some dysfunction going on, one thing for dancers to know is that these muscles actually have a direct connection anatomically to your hip. So especially your deep hip rotators, AKA your turnout muscles, if you're a dancer that uses turnout. So if your pelvic floor muscles are unhappy or having problems, that can actually relate to your hip function. So I've had a lot of dancers come to me with symptoms of hip impingement or a pinchy hip, or they feel like they're just kind of stuck, or their hip is not turning out the same, and they're having very, orthopedic sounding hip issues. And sometimes we do simple things that teach them to relax the pelvic floor or even externally treat the pelvic floor and their breathing, and it will actually change their hip function, and their hip will kind of experience like, wow, I can actually move it better and it's pinching less. So something that's really cool is to know that the pelvic floor it's actually, and it's not magic, it's actually attached to those muscles through a fascial connection. And so the tension in your pelvic floor can impact the tension in your hip. And conversely, if you've had a chronic hip injury or a chronic hip issue, it would not be surprising that your pelvic floor might be a little out of balance in response to that. So huge impacts on the hip in particular, as well as just your efficiency in your breathing and your core control, because it's really one of those pieces. It's like the floor of all of that support. So if you don't have optimal coordination there, sometimes you're missing out. That's where we might be talking about that 1% that you mentioned before. That could be this place where maybe it could actually up your game just to improve that function of your pelvic floor as it works with everything else in your body. It will actually make you likely a more efficient breather. Yeah.
Yeah, definitely. It's just so relevant for dancers. And I love how you've looked at it from both sides. So looking at it as in it could affect things like your hip, but also if you've had problems with your hip, that it could go the other way as well. I think that's definitely important to consider. So specifically for dancers then, because that is mostly my audience, who can they go to for help? So a healthcare provider who would understand the importance of it for dancers. What kind of treatment is there available?
Yeah. So most commonly, it would be a pelvic floor trained physical therapist or physiotherapist, depending where you live. So depending, so I'll talk about the training here in the United States because that's what I know the best. But for example, in our entry level physical therapy programs, physical therapists might get a little, lecture, a little introduction in the pelvic floor, but they might not learn all the specifics. So it's still somewhat something where you have to go to a little more continuing education to know how to assess it. So, most physical therapists or physios will usually have listed that they are a specialist in, or they've had training in assessing the pelvic floor. So you want to look for basically a pelvic floor physical therapist. And that could be someone who does orthopedics, but they also know how to assess the pelvic floor. And so that's would be ideal. And there's different places. I can send you these if you want. There's some links to search for pelvic floor physical therapists. And one of them has a little bit more international listings, so that might be helpful depending on your audience. We have a couple search engines that are common in the United States, so it can vary from country to country. But you can go online and you can look for someone who specifically has training in pelvic floor physical therapy. And what that will typically entail can be, it all will depend on you, your comfort level, your consent, and talking with the physical therapist about what you need. It can involve an internal exam of the pelvis. So that would be either intravaginal or interrectal. And that usually happens after you've had a long conversation, you've talked about your history, and they've looked at other things that a physical therapist would look at, like how you walk and what your strength is like in your hips and how you breathe. So, but that internal assessment is usually something where they're assessing your actual muscle strength. So how can you do a Kegel? How do you hold? Do you have a lot of tension? Do you have a lot of pain in those muscles? And again, that can be done with, if you want to have an extra person in the room for your comfort. It's all very much based on the patient's comfort level. And it might not be something that's done every session. But people can also assess the pelvic floor, we call externally, which means that you don't necessarily have to have an internal exam. If that's something that you're not ready for, you can still go to someone who's very educated and trained in the pelvic floor, and they can look at how those muscles are functioning without internal exam and be able to help you figure out whether or not you need to strengthen them, whether or not you need to learn to get some more length in those muscles and relaxation. There's lots of strategies for that. And then how are they functioning? How's that area functioning in relation to the rest of your body as an athlete? So ideally, it's great if you can go to someone who knows dance and athletics and knows pelvic floor. But even getting a pelvic floor assessment from someone who's really specialized can give you information to put together with maybe another rehab professional that you're working with on other things, if that makes sense.
Yeah, perfect. I want to ask a little bit about, it's not on our prompt sheet, so if you want a minute to think, feel free to take one, but I just want to ask a bit more about the use of breath and the link with that. I'm not sure if it maybe fits in this question. So my next question was going to be, what can dancers do to optimize their pelvic floor health? I'm not sure if it can link in there. Does that work at all? But just a bit more about, the function of breath and the link between the two, because I find that really interesting.
So if you're thinking about relaxed, quiet breathing, for example, and you visualize, so the diaphragm is kind of like a big umbrella or a big parachute, that sits toward the lower part of your rib cage. And so it's like a lid, but it's like a very parachute-y kind of lid. And so if you imagine that dome on top, and then you imagine the pelvic floor is like the reverse, it's like a hammock, and they sit underneath like this. And I know for podcast listeners, I can't see my hands, but I'm kind of making a dome on top and then like a little cup on the bottom. And so they sit appositionally to one another. That's we can sort of think of that as like they're in parallel. So in relaxed breathing, when you inhale, your diaphragm should flatten and kind of move downward and push toward your belly. And your belly should soften. So for dancers out there who've never been taught that their belly gets to soften sometimes, I'm going to tell you today, you do not need to pull your belly in all day long, all the time. That's actually not that efficient. You can let your belly go sometimes. So when you inhale, your diaphragm should drop down and your belly should get a little softer and relax a little bit. And at the same time, that's usually when your pelvic floor should also slightly lengthen or relax downward, like if you're sitting toward the chair. And it's not like they're small muscles, so it's sometimes hard to actually feel that happening. So we inhale and the diaphragm and the pelvic floor should lengthen or move downward. And then when we exhale and we push the air out, the pelvic floor will lift back up toward the nose a little bit, and your diaphragm goes up towards your nose. And that should make sense, right? Because it should push everything upwards so that we push the air out. So, for dancers who are listening, you can kind of think about that quietly and try to imagine that, as your lungs fill up with air, your pelvic floor should lengthen downward or move down toward the chair, and your diaphragm should move down. And that's why your belly should soften, because it's kind of pushing all your organs, right? And then everything should recoil and come back up. And then what might make the most sense to some of your listeners could be, if you make a more forceful exhale, you might be able to feel, your pelvic floor actually lifts up a little bit more intensely because it's helping to push the pressure up. Or if you have trouble feeling that, I'm not going to sing for you because I'm just a terrible singer, but you can sing. You can sing particularly like a high note because that's a big breath, right? You can yell and you can feel how that actually, your pelvic floor should kind of respond and do a little lift because it's working together with your diaphragm. So something that's really cool is when you start to learn about this, you realize that you can actually help your pelvic floor function well by just learning lots of different ways of breathing. Because when you breathe and you move your diaphragm, you're going to be moving your pelvic floor, and that's a good thing. And one of the things I see dancers maybe develop a habit of, I think sometimes we teach this, is like, we're all about pulling up and in and lifting and pulling our belly in and scooping and, tensing our hips. And all of that is like this up phase of the pelvic floor. And we don't always spend as much time focusing on the like softening phase. And so that can be a piece where we end up holding our breath, we end up sucking in too much, and we also end up tensing our pelvic floor a lot of the time when we actually don't need to be. And so if we can learn to breathe a little bit differently and a little more, expansively and in new ways, it can be hugely impactful on the pelvic floor.
Yeah, definitely. I find that so interesting, the use of breath and how it links to so many different things. So that was great to hear for me. I'm sat here breathing, trying to work it out. Thank you, Brooke. Is there anything else that dancers can do to optimize their pelvic floor health?
Yes, I would say, so breathing was actually the first thing I was going to bring up. The second thing to optimize health has to do with understanding the idea of your core a little differently. And this could be like a whole class. But it relates to what I was mentioning before, where I think that it can benefit a lot of dancers if this is their habit, that stabilizing means like drawing your belly weight in and holding it in is actually a lot of squeeze pressure above the pelvic floor. And the pelvic floor is sitting down here trying to look at the pressure coming from above. And if you are squeezing the heck out of the pressure system above it, it's going to go, oh, I better really hold on. I better tense up. So I think that something that dancers can think about is when you're thinking about, your core, this is going to be different for every dancer because we all have different alignment habits, and not everyone has a problem where we're too tense there. But I see a lot of dancers who are and don't know how to relax. Is that your abdominals and your whole core should be functioning more automatically, meaning you should really be matching kind of the amount of tension that you build in your center to how difficult the task is. And some of the things I think we practice to learn how to do a good job with our cores will be like lying on our back. And I'm certified Pilates instructor, and I've been there. Like, we're trying to learn how to feel our abdominals and our transverse abdomen. And so we're like, I'm just lying here, but I'm going to really draw my abs in. But all you're doing is lying there. That's it. It's not that hard of an activity. So you actually don't need to be working that hard. And if you are releasing, or if you're just doing something simple, the amount of trunk contraction does not need to be that hard. But if you're maybe lifting a partner or you're doing something really difficult, of course you need to draw in a little bit more. So maybe just the general concept of kind of thinking about how much tension is actually required for your trunk in what you're doing, to notice if you overcook it sometimes. And just being aware of that can be really helpful for a lot of dancers. And I don't think you always need to do anything super fancy, but just build awareness about how much tension you bring to the party. Because a lot of times we do too much in our very, very good intent to be really strong in our core.
Yeah, that makes so much sense. The example that I had in my head while you were talking is I was thinking about, say, when you first teach a plie to a really young child and you say squeeze your core, engage your core, and all they're doing is a plie, but you encourage them to squeeze everything and really, really hold on. And that's like one of the easiest, not one of the easiest movements. I'll get into trouble for saying that, but it's a relaxation, or it doesn't require, it's not lifting someone up, like you said. So that was kind of the example in my head. I guess we teach to engage everything for that, and that's actually not what that movement needs. Is that kind of right?
Yeah. So, and of course it's going to be individual for each dancer. Like if you're someone who maybe has a lot of lordosis and really is overly arching the back and kind of needs to, but a lot of times I try to tell dancers to figure out, I mean, every teacher has their wonderful cues and ways of teaching, that are going to match every student. But, think about just changing where your bones are, not necessarily like having to only scoop in or tuck your butt, because that's another thing that a lot of students will do, right? In your plie example, maybe is along with that, like holding the belly in, they're trying to use their little turnout muscles so well, but they clench their glutes and they're like clenching so hard, and that's actually more tension than they need in their pelvic floor. And then their hips are really locked up and they can't move them as well. So yeah, I think it's an interesting exploration. So I do a lot of things where I help dancers try to explore like where your alignment is, or giving them tasks that are a little more external or cues that are general versus like one specific muscle. Sometimes that can help if maybe your student is someone who over tensions everything. Sometimes that can be a nice way to work.
Yeah, that's perfect. Could you tell us a bit more about your own research in this area? So you did an online study looking at the rates of dancers, was it dancers specific, who were experiencing pelvic floor issues? So the questions were relating to pelvic pain and their history. So if you tell us a little bit about what your study looked at, then about the methods and the data collection, and also about the results.
Sure. So this study we initiated, I guess has it been over a year? We started collecting data kind of as we were diving into early 2020, kind of right when COVID was hitting. And so luckily it was an online survey. It wasn't in-person data collection, so we could keep up with our survey. But I worked with 2 other physical therapists who also work with dancers and pelvic floor issues. And so our survey was specifically looking at professional dancers. So any dancer that identified as a professional and identified as female. And we asked a lot of different questions about, the style of dance they mainly trained and performed in, some general health history, what type of cross training they tended to do, as well as whether they experienced any type of urinary leakage. So we used a standard survey questionnaire that's been validated in previous studies so we've actually seen that used in studies of other athletes to gauge whether or not they experience leakage, urinary leakage specifically. We also ask a lot about menstruation symptoms, just to kind of see if there was anything correlated. We also asked about pregnancy history, birth history, and then whether or not they'd experienced an aspect of pelvic pain. Our main thing we looked at was actually the experience of leakage, but we did want to ask at least one specific pain question which was, have you ever experienced pain during sexual activity or intercourse? And so this was distributed online. And we've gathered data from a little over 200 professional dancers who answered the survey anonymously, and a little over 30%, so very similar to other sports, reported experiencing urinary leakage. And the most common type of leakage was what we call stress incontinence. So that's like, I leak if I cough or sneeze or jump or land. And then we had a small proportion that also experienced what we call urge urinary incontinence, which is, I've really got to go. And now I can't hold it to get to the bathroom. That was less common. And that's actually really consistent with what we've seen in studies of other athletes. So similar numbers and similar types of symptoms. What was also interesting is over 40% of our respondents had experienced pain with sexual activity or intercourse, which is almost half. So that's really significant and something we'd like to look into further. And then, a fair amount, it wasn't the main goal of our study, but a fair amount that experienced, changes to their menstruation or menstrual cycle in relation to activity. So I'm curious to look further down the road about how things like relative energy deficiency in sport, or basically low fueling, low amount of energy, and how that might be relating to pelvic floor symptoms. We didn't find anything like that in the study, but it sparked our interest.
Yeah, for sure. I can see how that would be interesting. Those results are higher than I would expect. I mean, maybe I'm just not that well read in this area, but yeah, it's just higher than I think I would expect. But what I think is interesting is that it's comparable, like you said, to other female athletes, so perhaps rhythmic gymnasts. Have you got anything else to add here?
Yeah, our population what's interesting is I agree, it's pretty significant. And, I talked to a lot of people who are like, really, dancers leak? I'm like, well, a lot of people don't talk about it. But we actually see very similar results to that in other athletes. Um, I for me, because it's the area where I live, in terms of clinical practice, it's not as surprising because, like, I, in my job, when I work with pelvic health, I'm someone who ends up seeing people who say, I had this hip injury and then it was lingering forever. And now I'm starting to leak a little bit, or now I have pelvic pain. And it was something that sort of happened because of an orthopedic injury, which is really common. We have high rates, even in our study, we had really significant rates of people who'd had a hip pain in the past and low back pain. So yeah, clinically, I wasn't surprised because I hear a lot of stories from dancers. I work with a lot of adult dancers who've danced maybe longer, who've experienced more things. But what's really interesting is very few of the respondents in our study had been pregnant or had a baby. So this wasn't something that was because of, childbirth or because of labor and delivery, which is a common risk factor for experiencing things like leakage. It was the numbers are pretty similar when we removed our participants who'd been pregnant before. Maybe changed by a percentage or two, but it wasn't a big change. But we kind of sit with a lot of risk factors for pelvic floor dysfunction as dancers, and I'm happy to talk about more of those. But I don't think it's something that people like to shout from the rooftops when they're experiencing it, because it can be really uncomfortable. And I will say I was a kiddo with my gymnastics history. And then in dance, when I was kind of through adolescence and I was still participating really, really intensely in gymnastics, I would experience leakage at random times, and I never told anyone because it was embarrassing. And then once I became a PT and I started working with this population, I was like, oh, I wish someone had told me that that was actually really common when I was, an early teen and was totally freaked out by these symptoms. Because, I think we need to make it more, I guess, common to talk about so that we can try to really get to know those real experiences of people out there.
Yeah, definitely. Could you tell us some more about some of the common risk factors for dancers? Because that's something really interesting. So when I've always sort of heard of pelvic floor in the past, my main first thought is always pregnancy. And that's kind of just what I've always linked with. So I find it interesting that it stands on its own for dancers without that. So what are some of the common risk factors in dance?
Yeah, so some of them we draw from research that we've seen outside of the dance population, and some of this is, still needs to be tested. And these are things that we think is happening clinically, but we don't yet have the proof. So starting with things that we know are associated with pelvic floor issues, history of low back pain or low back injury is highly in the general population is highly correlated with experiencing pelvic floor symptoms. So, if you've had back pain or back injury in the past, it's not unusual that you would experience a problem with the pelvic floor. It just seems to be very linked. And we have pretty high rates of back pain in dance in general. And we've seen that in some recent studies that for, certain dance genres in particular, we have pretty significant experiences of back pain. So it makes sense that if we're pretty prone to that type of injury and that's really linked, that it wouldn't be that unusual. We also have high rates of hip injury in dance as well, which hasn't been as directly linked, but we see a lot of links between there's some emerging research that's showing links between hip strength and pelvic floor symptoms. So we don't know the whole story yet, but it's not uncommon that a lot of dancers, especially if they haven't had a lot of exposure to strength and conditioning or cross training information, that we're actually often not quite strong enough to do the hard things that we do. And so if there's a mismatch in hip strength to what you're trying to do, that could be related. We also know that impact activity seems to be correlated with more risk for pelvic floor symptoms like leakage. So we're not we don't have the same amount of impact as, say, a trampolinist, but we jump and land a lot. And if you're a breaker, maybe you're upside down and you're impacting the floor a lot. So we actually are fairly high impact athletes, depending on what form we're practicing. And we don't really know why. We just know that there's a correlation. It could be just that there's an overuse component. It could be that we just subject ourselves to lots of impact and pressure, which could just wear and tear at our pelvic floor, but we just really don't know the answer to that yet. We also have pretty significant rates of hypermobility. We have lots of very bendy, very flexible people who land in dance. And there is some connection, particularly with maybe more systemic hypermobility. So people that have Ehlers-Danlos syndrome or more significant hypermobility symptoms, which are, can be very common in dance, tend to have a correlation with menstrual pain, with pelvic pain, as well as slightly higher risk of pelvic organ prolapse, which is like the pressure symptoms. So again, we don't know if this is exactly impacting dancers, but we know that hypermobile issues can relate to the pelvic floor, and there seems to be a correlation. And then some studies of athletes have looked at disordered eating or low energy and seen that seems to correlate with a slightly higher risk of urinary leakage. And again, we don't know why, we just know it's connected. And we do know that we have significant rates of low energy or disordered eating patterns that are very common in dance. So we kind of span a lot of these common risk factors, and there's not enough research that exists yet to know if that's really why we might experience these things, but these are some of the reasons why I'm not surprised.
Yeah, that makes sense. I can kind of see it all fitting together a little bit now, which is, it's interesting to think about. So like you've just said there, as with everything, especially in dance, there's always room for more research, which is really exciting. So you mentioned possibly exploring more with teens and adolescents with future research, or possibly looking more at outside of the female identifying gender. So what do you hope to explore next is kind of my last question today.
Both of those I would love to do. I think we need more survey research. I'm not sure which one we'll start with. We definitely need, information outside of this female identifying dancer that's a professional. So we need to look at multiple, levels of dance, as well as, like the span of how we identify in terms of gender. But another thing that I'm starting on, but it's the very, very beginning, is, we talked about breath and pelvic floor. So I have connected with someone who was a dancer, but is now really well trained in vocal pedagogy, and so is someone who works with a lot of musical theater students and a lot of commercial singers. And we're trying to look at how we can understand techniques for voice and how that might help us get the pelvic floor to work efficiently, and then how that might be helpful for dancers in their training, particularly dancers who maybe have to sing in whatever job they get, or dancers who never ever have to really use their voice. So we would like to explore also, what are pelvic floor symptoms that musical theater performers are seeing. So that's kind of a cool project, and I'm not sure what it's going to look like yet, but that's my next venture.
Yeah, I can't wait to see it. Today, more than anything, Brooke, has been, so useful and so informative. Thank you so much for your time. It's just so different to anything I've looked at before. And it's kind of different to the ones I've recorded so far this series. It's a bit more, a little bit more focused, and hopefully really, really useful and informative for dancers. I know that I've learned a lot. It's been an absolute pleasure talking to you. Is there anything else you'd like to mention or discuss today?
I can't think of anything. I could go on forever and ever about the pelvic floor, but we have to stop somewhere.
For sure. But honestly, I think we've covered so much, and who knows, maybe a part 2 in the future. But definitely covered a lot of ground today. So it's amazing. Thank you so much, Brooke.
Yeah, thank you for having me. This was lovely.
Not a problem. Chat soon. Bye. Thanks so much for listening. Tune in again next Monday. And in the meantime, follow @SideDancePodcast on Instagram. It would also be so appreciated if you have a moment, if you could please rate and review on Apple to help the podcast grow. Bye.